Well, time now for our mental health moment of the week. We're talking about the cold, the short days. It's winter in Maine, and these months can present challenges for those with substance use disorder and those in recovery. Here now to discuss is Ali Zubrod, clinical supervisor at Sweetser's Hope and Healing Center in Brunswick. Ali, welcome. Thank you for coming by. Such an important topic. So why can winter be especially challenging?
Well, Mainers are susceptible to seasonal affective disorder. The long winter months with short days and little sunlight can lead to low moods, and people can feel like they're stuck at home, so they might feel bored or lonely and isolated. There's also some winter-specific financial struggles like home heating costs or the upcoming tax season. So it makes sense why folks want to reach out and use substances or alcohol for immediate relief, but we know that long-term chronic use of alcohol and substances can lead to more significant mental health issues.
Let's talk through maybe how folks might be able to cope and work through some of the obstacles that you mentioned.
Yeah, so one thing we want to do is create structure, so you can make a daily schedule for yourself filled with exciting or fun hobbies. We want to find ways to break up the stress and loneliness that feel good in the present but also feel good for you long term. Yeah. The second thing you can do is get moving. So we know that small consistent movement like indoor stretching or short walks can actually release dopamine, which is a feel-good hormone.
Yeah, move a muscle, change a thought.
Yeah, exactly. Yeah. The last thing we can do is get connected. So we know that connection is the opposite of addiction. So there are free virtual recovery communities online, such as AA or NA Zoom rooms or Smart Recovery. And if you happen to live near the Brunswick Hope and Healing Center, we have a drop-in peer center, so you can get connected to folks in real time in a safe and sober environment.
Get connected, right? Find some folks to talk to.
Be with other people.
Yeah. What if somebody is willing to reach out right now and get some help, which we know, Ali, is a very tough decision to make and a big decision. Who might be available immediately to assist?
Yeah, so Brunswick Hope and Healing Center has a substance use IOP that's available. This program is intense, it provides structure, and it allows people to start building a recovery community. Our substance use IOP runs from Monday through Thursdays, and our IOP team of providers are warm, non-judgmental, and they'll work with you to create a custom treatment plan that makes sense for you. Because our substance use IOP program is in our Brunswick Hope and Healing Center, you have access to additional clinic services or our peer center, so you can get holistic wraparound care all in the same building.
It's really a lot of options, right?
There is, yeah. Customize your treatment.
Yeah, well, we know we've got snow coming in tonight. Yeah. It's going to be tough to get out there, so plenty of ways to get connected with folks. All right,
right.
Ali Zubrod, clinical supervisor at Hope and Healing Center in Brunswick. Thank you so much for coming by and sharing some of these helpful tips for us today.
Thanks for having me.
All right.